Hello guys, nice to see you again. Let's enjoy Dr. Y Chest Radiology. I'm Dr. Y, medical professor, chest radiologist in Seoul, Korea. Lesson 55. Today we're gonna talk about micronodular patterns in chest CAT scan. Let's go. There are diseases known as micronodular lung diseases, which show diffuse involvement of micronodules on the lung. And if we know these three characteristics of distribution pattern, we can narrow, even pinpoint the diagnosis of this micronodular lung disease. The definition of micronodule is the presence of diffuse pulmonary nodules less than 3 mm in diameter. There are three types of micronodular patterns in thin section CAT scan. Number one is centrilobular pattern. Number two, perilymphatic pattern. 3. Random distribution pattern. The name shows the characteristics of this distribution pattern of micronodules. In the year 2024, on the Radiology Journal, the Fleischner Society redefined the definition of micronodules. Micronodule is a circumscribed and typically round opacity, previously defined as less than 3 mm, but currently defined as less than 6 mm in average diameter. Let's begin with the centrilobular micronodular pattern. As the name implies, centrilobular micronodules are located within the center of the second pulmonary lobule, where bronchioles and pulmonary arterioles are located. For example, the disease names are hypersensitivity pneumonitis, diffuse panbronchiolitis, respiratory bronchiolitis, infectious bronchiolitis, and the famous post-primary tuberculosis. Second, perilymphatic micronodular pattern, distributed along the pulmonary lymphatic system, which includes the interlobular septum, visceral pleura, and peribronchovascular interstitium. The disease samples are sarcoidosis, pneumoconiosis such as silicosis, core minus pneumoconiosis, lymphangitic carcinomatosis. The third one, the last one, and actually combined one, is the random micronodular pattern, distributed throughout the secondary pulmonary lobule, usually represent the hematogenous dissemination. For example, hematogenous infection such as miliary tuberculosis, miliary disseminated fungal infection, and the last one, hematogenous metastasis, hematogenous miliary metastasis. Before entering the tour of chest thin section CT of a micronodular pattern, we have to revisit the classic anatomic picture of a secondary pulmonary lobule, which was shown by Dr. Ito Harumi in 1993. The base here represents the visceral pleura, and the S represents interlobular septum, another interlobular septum. The distance is almost 1 centimeter. In the central portion, centrilobular portion, B represents the empty one, bronchial, and A represents pulmonary arterial, filled white one, and this B represents venous drainage system, which compose septum. So, as you can imagine, centrilobular nodules are here in the center of the lobule, and perilymphatic is here, visceral pleura, septum, bronchovascular bundle, and vein. And random means everywhere in this picture. May I introduce you a wonderful picture painting of 1884 by the painter George Seurat. The trend is pointillism. Points means, for me, micronodules. Of course, points is more smaller than micronodules. This picture is named as Sunday afternoon at the Grand Jatte Island in Paris. Actually, it is displayed in Chicago Art Institute. It is not brush touching. It is just a point. Every point represents the component of color, and that point shows this wonderful painting showing 1884 in Paris, Sunday afternoon. This is pointillism, micronodules. This is the second most important slide showing algorithm approach of micronodules on the thin section CT. If we see the plural, actually visceral plural, fissural nodules, if we say yes, there are two ways. One is the nodules, if the nodules are plural, septal, peribronchovascular, it is perilymphatic distribution, and the disease must be sarcoidosis or pneumoconiosis or lymphatic carcinomatosis. With plural nodules and showing diffuse involving all lobes and no predominance, that means random distribution. Then the disease should be miliary tuberculosis, miliary fungal infection, or miliary hematogenous lung metastasis. If we do not see any plural visceral fissural nodules, we can say, oh, they are centrilobular distribution, and the disease must be hypersensitivity pneumonitis or diffuse panbronchiolitis, or it can be respiratory bronchiolitis. This slide is actually the most important slide among this lecture. The white line is interlobular septum. I made this one. I myself made this slide. Number one, the first one is centrilobular pattern. This one, in the center of the lobule, in the center of the lobule, there are nodules. They are centrilobular pattern, and second, perilymphatic pattern. In the septum, in the visceral pleura, in the fissure, in the bronchovascular bundle, they are perilymphatic distribution. And the last one, the random distribution, is actually combined with centrilobular and perilymphatic. They are showing us pleural, centrilobular, septal, bronchovascular, everywhere. This is the random pattern. Now let's start our journey of museum travel. The museum name is Museum of Pointillism. The first one is centrilobular. The name of the disease is diffuse panbronchiolitis. Let's first see the thin section CT and move to our eyes to chest X-ray. This will be easier for us to understand the findings. First one, let's see. Are there any pleural fissural nodules? Nope, there is no nodule in the visceral pleura or fissure. So where are the nodules? This one is the septum. So this one is the septum. So these nodules are centrilobular distribution, some showing branching pattern. This round one represents airway, and usually the bronchus, the larger bronchus, are also involved in this disease, bronchiectasis. This is a centrilobular pattern of diffuse panbronchiolitis, famous for Korean, Japanese, and Chinese middle and old-aged men. This second painting is also centrilobular pattern. Do we see any pleural nodules? Fissural nodules? Nope, not any. And the many ill-defined micronodules are centrilobular distribution and also showing diffuse ground glass opacity without bronchiectasis. This is the subacute phase of hypersensitivity pneumonitis. The chest X-ray shows mild and diffuse peripheral ground glass opacity and micronodules of pointillism. This is the famous hypersensitivity pneumonitis. Let's go to the next room. Next room is perilymphatic. And let's see, where are the micronodules? Oh yes, visceral pleura. There are many micronodules in this visceral pleura. We see here and everywhere is a pleura. And diffuse ground glass opacity and along the bronchovascular bundle there are also micronodules. So this is perilymphatic distribution of sarcoidosis. We also see the enlargement of lymph node here. And we sometimes say this sign as galaxy sign, characteristic of sarcoidosis. What about the chest X-ray? Ground glass of micronodules, galaxy, like galaxy, bilateral, and four lymph node here. Right hilar lymph node, left hilar lymph node. This is sarcoidosis of young men. Another perilymphatic distribution, old man history with history of co-worker. Do we see pleural nodules? Pleural micronodules? Yes, we see pleural micronodules, fissural micronodules also, and the micronodules are more coarse and larger than the sarcoidosis. And this bronchovascular bundle, along this bronchovascular bundle, there are also micronodules. This is also the famous perilymphatic distribution of pneumoconiosis. And this one is actually the progressive massive fibrosis, PMF. Do we see the coarse, large micronodules dominantly on the upper lung, and we see bilateral progressive massive fibrosis here with history of co-worker. This is also the famous one, perilymphatic distribution showing lymphangitic carcinomatosis. Left one is okay. This is the unilateral disease. Most of the perilymphatic lymphangitic carcinomatosis is unilateral disease. That is also characteristic. How about this CT? Oh, uncountable. So many pleural nodules, so many nodules and masses in the bronchovascular bundles, even without normal findings. And we see many septal lines thickening over here and here. And intracentral portion, there are also nodules. We say in this case, this is the prominent central core. And this linear line showing arcade sign. This is lymphangitic carcinomatosis. Most of them are from lung cancer of ipsilateral side and sometimes from breast cancer with bilateral involvement. Now let's get into the last room. The last room shows a random distribution. Let's see, what is random distribution? Do we see the pleural nodules, fissural nodules? Yes, we see fissural nodules, pleural nodules, but not so many. Anyway, there are pleural nodules, and the micronodules are scattered everywhere, very small. So we sometimes call it miliary tuberculosis rather than hematogenous tuberculosis. This is miliary tuberculosis of young women. There are many scattered micronodules right and left lung with four lymph node enlargement in young women. This is miliary tuberculosis. Maybe this will be the last picture of this museum. Do we see any pleural nodules? Yes, here it is. And do we see another nodules? Yes, scattered everywhere. Someone is larger, someone is smaller, and in general, bigger than the miliary tuberculosis. Actually, these are hematogenous metastases. The nodules, micronodules, are bigger and more variable size than miliary tuberculosis. Let's see the chest X-ray. In the left lower lobe, there are large lung cancer here and many scattered micronodules. Okay, micronodules in bilateral involvement. This is miliary hematogenous metastasis from lung cancer. Now we mastered micronodular lung disease in the CAT scan. Now you are master of micronodules. Congratulations. Sir, you quit smoking? Whoa, so nice. Very good for you. Of course, also subscribe. Thank you very much. You are so awesome. Be happy and healthy and wealthy. Thank you very much.